My name is Katie Tewkesbury and I am the TRiM lead for ESHT alongside Kim Borman as part of the Staff Engagement and Wellbeing team. TRiM stands for Trauma Risk Management and is a way of supporting our staff after a potentially traumatic event at work. TRiM originated in the military to help prevent PTSD by understanding the effects of psychological trauma. The process is designed to identify a number of specific risk factors which, if present, increase the likelihood of longer-term poor mental health. Not only does the process provide a safe space to talk through the trauma, but is an assessment to see how much stress they may have taken on, which is scored both after 3 days and in 1 month's time. It is often at this stage we are able to see if a referral is required for further support, such as trauma therapy. This is a new TRiM poster which we're hoping to get displayed in every clinical area, which explains what the service provides at a quick glance. I just want to highlight a few of the points. Firstly, it is a confidential service and no record is kept on OC Health records, and that includes if they get referred on for trauma therapy. Secondly, anyone can refer. You don't have to be a manager, you can also self-refer. There are no forms to fill in, just send an email to the TRiM inbox, which is esh.trim@nhs.net. We wanted to keep the process as quick and simple as possible. Thirdly, it is not a clinical debrief, not to look at blame or to problem solve, and it's certainly not to excuse poor behaviour or to smooth over any long-standing problems. Just an opportunity to talk through the incident in a safe space and to get the correct help in order for them to deal with what has happened. So what is a potentially traumatic event, or PTE for short? Anything can be traumatic, which is why we call it a potentially traumatic event. What some people see as a trauma, others may not, and just see it as just another day at work. People can also be triggered by previous experiences or something in their personal life which may be hindering how they would normally cope. We also know that sometimes it can be an accumulative stress rather than an isolated event, or simply the straw that broke the camel's back. We're also seeing a great number of people as a direct result of what they dealt with during the pandemic, and it's only now that things are starting to get back to a new normal that people are reflecting back and struggling with what they have witnessed. Staff are tired and tolerance is low. Of course, it is not our intention to change people's built-up resilience, but just to help those that need some support. This is a timeline of events for TRiM. The debrief diffuse I will talk about more in the next slide, but this should be done on the day by the manager or the shift leader. And that same person should then refer the incident to TRiM, whether this is for an individual or for a group, where a planning meeting will decide when the assessments will take place. Ideally, this should be done after 3 days of the PTE, but no longer than a week. During this first assessment, the person is scored for acute stress reactions. They're then monitored until their 1-month follow-up. We will either see a reduction in their scores as life starts to get back to normal, or their scores remain high. It is at this point we can then signpost them to other help available, like trauma therapy. So this is a diffused crib sheet which can be used by the manager or person in charge to support their staff after the trauma. As it's hard to read, I have split it into readable sections. At first glance, this seems very obvious, but I wanted something that was easy to use and all on one sheet. Often the manager too has been affected, so this crib sheet is to help them, as it can sometimes be very overwhelming. Check in with the staff and acknowledge what they have experienced, and if possible give them time out. Offer staff the opportunity to take time out of their shift to have a walk or a break. Try to reallocate or pause duties if feasible and safe to do so. Allow them a chance to talk, reassure them that emotional responses are normal and likely to reduce over time. Ask if they feel okay to carry on with their shift, and encourage mutual support with work colleagues, and this may reduce the risk of feeling isolated. Try and be present throughout the shift and check in again with your staff to see if they are feeling okay. Offer the opportunity again to take time out if possible. Offer to meet with anyone who appears to be significantly distressed or seems like they may not be coping. And try to be present throughout the shift and available for one-to-one meetings with your staff if needed. At the end of the shift, check what support your staff have once they finish work. Who would they normally go to for emotional support? Encourage them to reach out and access this. Are they okay getting home, particularly those travelling alone? Is staff safety a concern that you need to consider? Are your staff fit to return to work for their next shift? Many staff find that continuing in work is beneficial for their well-being. Emphasise the importance of self-care, especially rest and seeking out support. Don't forget about yourself. Make sure you follow your own advice. Make sure you've given all your staff a TRiM leaflet before they leave work and remind them of the support available from Care First. Make a list of names involved and which department they are from to hand over to the TRiM lead. Email the TRiM lead giving details of what has occurred. You will receive a response within 24 working hours. A reminder of the email address esh.trim@nhs.net. Follow up with your staff over the next week or hand over to another manager if you're unavailable. Work with the TRiM lead to plan appropriate next steps. Thank you for your time in watching this presentation, and please remember that the Wellbeing team is here to help and support all of you.